Good morning, ladies and gentlemen. Welcome back to lecture 5 of week 1 of this course on physical medicine and rehab in sports. In lecture 5, we'll be dealing with some rehabilitation scenarios for common sports injuries so that we will be able to give you an outline about what are the common sports injuries and what are the rehabilitation strategies which are used, because otherwise each injury is a topic in itself. I'll be covering this lecture as per the following outline: introduction, goals and phases of rehabilitation, principles of rehabilitation, rehabilitation for common injuries, screening and neuromuscular training, orthotics, nutrition and psychology in rehab, future trends, and we will conclude with a take-home message. What is rehabilitation? Rehabilitation is a structured, progressive program designed to restore function, reduce pain, and facilitate an athlete's safe return to activity. Why is it important? Its importance in sports injury recovery is because it helps the athlete regain strength, regain flexibility, improve his coordination, and regain confidence after an injury. The goals of rehabilitation are to restore joint mobility and muscle strength, prevent re-injury through proper movement patterns and conditioning, and to ensure a safe return to sport-specific activities. The goals are also to address psychological aspects of injury recovery. Phases of rehabilitation. There is an acute phase in which there is immediate post-injury care, pain control, and inflammation management. There is a subacute phase wherein you start controlled movement, progressive strength training, and neuromuscular retraining. And there is a functional recovery phase wherein you have advanced strength training protocols, agility drills, and return to play preparation. As we can see, these phases cannot be dealt with by one particular individual. So it is a team effort between sports physicians, PMR specialists, physiotherapists, athletic trainers, nutritionists, psychologists, and SNC coaches. We must discuss something about the principles of rehabilitation. Rehabilitation should be an individualized approach based upon severity and type of injury. There should be a gradual progression of exercises. We should have good pain management strategies. There should be real-time daily monitoring for complications. And rehabilitation is always a multidisciplinary approach. Let's see how the soft tissue healing process looks like. There is an inflammatory phase of 0 to 7 days in which there is pain, swelling, and redness of the damaged tissue. There is a proliferation phase between 7 to 21 days in which there is tissue regeneration and the beginning of scar formation. There is a remodeling phase between 3 weeks to months in which the new tissue becomes gradually strengthened. However, there is a role of controlled movement in each phase. You cannot let the individual just rest and forget about healing. Let's start with ankle sprains. Rehabilitation of ankle sprains. In phase 1, police or RICE protocol, pain control, and immobilization may be required if it is severe. Phase 2, range of motion exercises along with balance training. And in phase 3, you have strengthening, proprioception drills, and sport specific activities. ACL injuries of the knee. There is a difference in which you have to have something called prehabilitation or pre-surgery rehabilitation, in which there is activation and strengthening of the quadriceps and hamstring to minimize atrophy. Post-surgery, gradual weight bearing, controlled motion, and early neuromuscular training. The final phase involves plyometric training, agility work, and cutting drills before return to play. Rehabilitation of hamstring strains. Early stage, rest and pain control. There is an exercise called Nordic hamstring curls, which allows the hamstring to go through progressive eccentric strengthening. Running drills before full return to sport, and if there are any muscle imbalances, you have to address them. Shoulder dislocations. Initially, there is immobilization followed by passive range of motion. Then you start with scapular stabilization and rotator cuff strengthening, and then gradually come down to sport specific throwing and pushing biomechanics. Rotator cuff injuries. The rehabilitation involves pain control and gentle mobility work. Strengthening of the rotator cuff and the scapula stabilizers, and later functional drills based upon demands of the sport. The demands of rotator cuff injury in a throwing sport like baseball is different than a boxing. Rehabilitation of Achilles tendinopathy. Eccentric loading exercises very early in the rehabilitation phase. Biomechanical corrections involving gait analysis and footwear modifications, and a gradual return to explosive movements. Rehabilitation of stress fractures. Immediate load reduction and modification in weight bearing activities. You have to give nutritional support for bone healing like calcium, vitamin D, protein, vitamin B12 and magnesium and zinc. You have to ensure that there is a progressive return to activity with control of impact upon the damaged limb. Tennis elbow. Rehabilitation involves range of motion exercises in the first phase, followed by isometric and eccentric exercises. You may also need to do soft tissue mobilization techniques such as manual therapy and massage for proper healing, and gradual loading of the forearm musculature. Rehabilitation of patellar tendinopathy. Isometric exercises to reduce pain. Progressive strengthening using isotonic and eccentric exercises, and good quality plyometrics before return to sport is essential in the rehabilitation of patellar tendinopathy. Groin strains. Immediate rest with gentle mobility. Start core stability and hip strengthening exercises, and sport specific agility drills. Low back pain in athlete. Immediate rest, core stabilization, postural correction, movement retraining, and gradual return to impact activities. Functional movement screening is a very good tool to do your periodic functional movement assessments. FMS and Y balance tests are used to identify biomechanical deficits and to modify training plans accordingly. Neuromuscular training is essential for injury prevention, to improve proprioception in injury reduction, for improving balance and coordination exercises, and neuromuscular training has a big role in ACL and ankle injury prevention. Return to play criteria. The joint should be pain-free throughout the full range of motion, and strength and functional performance benchmarks should be achieved. The athlete should be psychologically ready, and a confidence assessment has to be done prior to RTP. Role of physical medicine and rehab. Use of modalities for reduction of pain, inflammation, and improving tissue healing. Hands-on techniques such as mobilization, massage, myofascial release, etc. Prescription of tailored exercise programs. Education of proper movement mechanics. Drug therapy for reduction of pain and inflammation, and prescription of orthotics at the appropriate time. Role of bracing and taping. Support for unstable joints during rehabilitation, to enhance the proprioception during movements and training. However, there are limitations of bracing and taping, and the benefits in long-term use remain uncertain. Role of nutrition in rehabilitation. Good quality protein for muscle repair and recovery is vital. Calcium, vitamin D, collagen, vitamin B12, zinc and magnesium for bone and connective tissue health is required to be prescribed in adequate doses. Ensure that there is proper hydration, and anti-inflammatory diets are prescribed for optimal healing. Psychological aspects of rehabilitation. Make sure you are managing the fear of re-injury. Correct goal setting and motivation techniques should be used, and there should be sports psychology interventions in the athlete mindset during and before return to play during rehabilitation. There are some technological advances which have taken place in rehabilitation. Use of wearable technology to track the progress of rehabilitation. Artificial intelligence driven rehab programs with personalized exercise plans have been started, and role of virtual reality for movement retraining and neuroplasticity enhancement has been begun by a lot of PMR specialists. The future trends. PRP therapy, stem cell therapy for tendon and cartilage repair in regenerative medicine. Motion capture technology for biomechanical analysis for injury risk assessment and prior to return to play. Role of something called blood flow restriction training or BFR training to enhance muscle strength with low resistance loads. Basically, BFR training will cause greater strength gains in muscles with lower loads. 3D printed orthotics and prosthetics for personalized support during injury recovery. Role of telerehabilitation for remote monitoring and for virtual physiotherapy sessions. And AI and machine learning in rehab is very important for predictive modeling, for injury prevention, and for customized recovery plans. The take-home message: rehabilitation is important to restore function, prevent re-injury, and ensure safe return to sport. Make sure you progress rehabilitation as per the phases of rehabilitation. We discussed some common injuries and the approaches to their rehabilitation. Functional movement assessments, neuromuscular training, physiotherapy, nutrition, and psychological support are vital for a proper rehab program. And the importance of a structured and progressive approach for quality sports rehabilitation cannot be undermined. Please ensure you go through these reference material for learning and for preparation for the weekly test and for the course ending exam. I seem to have finished, ladies and gentlemen. This brings us to the end of week 1. Kindly ensure you prepare adequately for your course ending exam and kindly ensure that you submit the weekly assignments on time. Thank you for listening, ladies and gentlemen. Thank you and Jai Hind.